working with the health department, but is this a group of individuals who are doing CSI work?
Yes, it's done on a voluntary service. We do, unfortunately, as the organization, have to transport these doctors, organize accommodation for them, and also catering. But sometimes the community, the local communities, they do assist us when we visit them with the catering.
What can you share with us about the state of primary health care in this particular area and some of the major challenges that communities face?
The major challenge in that community that we were with yesterday is the review of their chronic treatment. That is diabetes and hypertension. And we know that this leads to stroke, hypertension mostly, and the diabetes leads to amputation of the legs with these patients. And then after someone gets amputated in that kind of environment, they are unable to use wheelchairs, so it keeps on the chain of events that complicates their lives. Some of the patients that we saw, mostly they had the blindness, secondary cataracts, and there is no screening at all for those conditions in those communities. So hence we always go there, and we like to go there most.
You mentioned diabetes and hypertension, but my understanding is that one of the biggest challenges there as well is TB as well as HIV. Is there any integrated services in that respect? And the Eastern Cape itself having high levels of inequality and TB being associated with poverty, just how widespread is this problem?
There is a lot of TB in one community, so as an organization, we always seek to use the mobile chest X-ray where we screen for TB. Yesterday, unfortunately, we didn't have that resource because of the restrictions and the time frame we had to prepare for this outreach with these unemployed doctors. But we did screen, we did suggest to the patients that clinically we suspected them to have TB, so that they can go to the local clinic with our referral letters where they can do the testing for both conditions, the HIV and the TB. But the one that was easy for us to manage yesterday, it was the hypertension and diabetes, because we did bring those machines with us.
I'm just wondering, from a sustainability point of view, integrated chronic disease management, as we mentioned, issues of poverty, and we've seen for years stockouts being a problem. Do you feel like at some point it would feel like just a drop in the ocean, the work that you're doing, albeit important and much needed?
It is a bit of a drop in the ocean, I'll be honest with that. But I believe with the assistance of the private sector in this regard, we can go a long way. For instance, yesterday we had more than 80 doctors. Some of them I can see on the video, they are doing blood pressures, they're doing blood sugars. Obviously, those are the procedures most of the time are done by the nurses. Then the patients, they come to see us with those procedures already done. But because we were the only ones who were working yesterday, so we had to do those things. But we saw all the patients that were
Is it data that you work with that can be passed on, particularly for community healthcare services? And I don't know if there are networks that can help continue the work that you're doing. Immune deficiency being something that's not easy to handle when you're dealing with some of the diseases that you mentioned.
The complexity in these areas that we saw, for immune deficiency conditions, those patients, they need support, the family support, and mostly there is a lot of old people in these communities. So if we stabilize the old community, the old population, they will be able to take care of the younger generation that is mostly affected by the immunodeficiency conditions, including TB. So the more we do these kind of outreaches, and the more we have a sustainable relationship with the rural communities where we can go back, because to go once in a community, it doesn't do enough justice. So we have to keep going back to those so that it can be a long-lasting, basic blood pressure check. We prevent the grandmother of a child who's HIV or who was born by HIV positive mother. And now the child is living with the grandmother, and the child needs to take her or his chronic medication, the HIV treatment in this case. So if we take care of the grandmother, we're solving also the issue of the child that is born HIV positive.
But what are your infection control measures that you can take? I know this is, as you mentioned, on a voluntary basis. Even though you are working with the health department, are you finding ways of counseling, talking to communities, educating them so that this is not a self-perpetuating cycle?
We do a lot of health education, and we believe in health education. But the more people are aware of the conditions, the better it is. The communities, most of that, as I said, we started in 2016, that we have visited previously. When we go back there, it's not as bad as it was the first time we were there. So there's always one step at a time. So there is improvement for each and every community that we visit. Even though we still believe we can do much better than we are doing at the moment.
Well, it certainly is a lot. A little goes a long way, as they say, and well done to you and those volunteers that you're working with. And here's to hoping that you get more support, whichever way you need it. Mawabo Tulano is Ingqanga, Group CEO, speaking to us about the work that they're doing in that area in